Hello, everybody. Welcome to our medical talk today. Today we're talking with Dr. Daniel Seiler from Zurich. He has his own practice, Urologie Rotes Schloss. We will have his URL in case you want to contact him in the comments. And we will talk today about bladder tumors and how to remove them.
Thank you so much, Peter, for having me.
So cystectomy, as I understand, is often performed when people have or patients have a bladder cancer. Could you maybe provide us with a little bit more insights on this procedure?
Of course, thanks for giving me the opportunity to talk to you and explain that to you. The cystectomy, when we remove the bladder completely, is only performed in patients who have advanced bladder cancer. So most of the tumors, 90% of the tumors are superficial bladder cancers, non-muscle invasive bladder cancer. So most of the patients, when they have bladder cancer, they can keep their bladder. But in some cases, 10% statistically, we have a situation where the tumor is further progressed and is infiltrating the muscle of the bladder, and then we are forced to remove the bladder completely. It's called cystectomy. Normally we perform that, or mostly we try to perform that also by the Da Vinci surgery technique with the robotic system, with smaller incisions to remove the bladder completely. And then we definitely, there must be some other place to keep the urine. So we have different opportunities, possibilities to kind of replace the bladder, whether by taking some bowel and constructing a new bladder, or we have the possibilities to do it called an ileum conduit, which means that we have kind of a stoma, a urinary stoma, where the urine goes through this stoma and is taken out, catched out by a little bag where you wear normally on the right side of your bowel. And this is depending what procedure is performed, is depending on the age of the patient. In elder patient, we normally try this, or we use this ileum conduit, which is this orifice on the bowel wall. And for younger patient, we try to kind of reconstruct a new bladder with bowel, so they can more or less have the same quality of life that they had before.
How do you do this? How do you reconstruct?
Well, we take about 50 centimeters of your bowel, of a part of the bowel, and then we kind of reconstruct a ball, a sphere, where we try to more or less imitate a bladder. It will be not the same. So the bladder has not the same quality as you had with your own bladder before, but it's pretty close to the situation you had before the operation. So you especially don't have any stoma somewhere, and you normally have more or less the same quality of life than before. But most of those patients have a little bit incontinence, especially in the nights.
But is the tissue kind of the same of our bowel and of our bladder?
It's definitely not the same. That would be that's still work in progress. That would be our wish for the future, that we can have tissue engineering, that we kind of can grow with our own cells a new bladder somewhere in the lab and then put it in again. But
how far is that away?
I think we are still 20 years away, or even more. So this is not realistic to talk about this. The research is, I mean, that's a wish of us, that we can, maybe one day with the printer, we can print out the new bladder. That would be fantastic, but I think I'm not sure. I'm pretty sure I will not profit from that technique in my working day.
Okay.
Yeah.
All right. So bladder reconstruction, all noted, understood. And you were saying the quality of life with this technique could be very similar, right?
Absolutely. And also even with the stoma, which is meaning that you have kind of a little orifice, the urine going through, flowing out into a little bag. Those people, even though you at the beginning have a little bit problems and struggle with the idea of having something like that, they have a very good quality of life. Sometimes even better with their own bladder, because those bladder cancer patients suffer sometimes really from bad quality of life. They have to go to the toilet very often. Sometimes they have to get up 10 times in the night. And the quality of life is super low. So with that operation, sometimes they get a really improvement of their situation.
Dr. Seiler, thank you very much for your time and willingness to share. We appreciate a lot, and we wish you a very good day, and thanks again.
Thank you for having me. It was a pleasure again, Peter. See you soon, hopefully.
Thank you.